In this video, I'm going to demonstrate foundation massage techniques to the hand. This is really useful if you're including these foundation massage techniques in a more therapeutic massage, but even from a sports massage perspective, it's nice to include the hand in with the upper limb. Quite often we might have clients that might have repetitive strain injuries or carpal tunnel, or even if the client might have medial or lateral epicondylitis, then bringing the hand into the treatment within the wider arm area feels really nice. And we do also have quite a lot of muscles around the area, and our clients who might be suffering from arthritic conditions or wider pain conditions, treating the hand area can be nice and releasing, can help to increase blood flow to the area, can help to reduce pain and mobility in the wider hand area as well. Okay, so the medium that I'm going to use today is lotion. This is lotion from Physique, but you can use whatever you normally use within your clinical room. So whether that's wax, whether that's oil, or whether that's cream. Okay, so I'm going to be treating the front arm here. Okay, so first of all, we want to apply the massage medium. So from here, I'm going to do full arm effleurage. So if we were coming into the hand within a wider treatment, we would have treated the upper arm first. Okay, so I'm going to put the medium on into my hand here, then I'm warming the medium, and then from here, I'm going to come into full arm effleurage. So as we come into the full arm effleurage, we're going to lift the arm slightly. Okay, so coming up around the shoulder joint, and we want to make sure that we bring this medium down onto the hand. So we're not hopefully the client's nice and relaxed. We don't want them to be lifting their arm as we effleurage the area. We want to be pulling and lifting the arm slightly ourselves from this bottom hand. Okay. So you're just going to do that enough to apply the medium to the area and to warm the medium up so it produces this oily type film, which we can see is all covered now. So now from here, I'm going to turn Lydia's hand over and I'm going to focus on some stretching techniques. So my thumbs here are coming into the center of the palm, and then I'm pressing and stretching the thumbs out to the side. Okay, it really depends on how much treatment time you've got available. Generally, we would do this a minimum of 4 times, just to really stretch that palm area. And what we want to be doing is trying to grip the tissue and stretch here by holding that palm either side. Okay, then from here, I'm going to support underneath the hand. I'm going to do some circular motions or circular superficial frictions, coming around the base of the thumb. Quite often we might have a trigger point in about here. So really press into the side of the thumb, coming around all of those knuckles and around that lateral side and medial side as well. Okay, I can come up around the bottom of the wrist joint as well up here, asking for feedback from the client at each time. Okay, so stretching out that palm before we move on to our next technique. Just going to come back into that full arm effleurage, coming back onto the hand as well with that effleurage technique. And then from here, you're going to stretch of the heel of the hand. Again, trying to bring, so you're using this part of your hand to apply the pressure, really coming in around that thumb and palm area. It's nice to do that effleurage sweep in between each technique. And then from here, I'm going to come into knuckling on the palm again, turning the knuckles round. So you're using this flat part. You're not pressing with your knuckle joints here. You're using the flat part here to stretch the palm. Now, depending on the size of the client's hand, sometimes it's quite nice just to turn that round so you can get that heavier pressure in around the thumb joint. So if you've got a larger hand, you might find that you don't need to twist your knuckle as you're doing this technique. Okay. And then from this side, we're then going to stretch all of the phalanges on the thumb, then coming onto finger joints. So I'm just literally gripping with my hand here and stretching that finger joint. Okay, I'm coming to the middle finger, stretch that once to twice, next finger, and little finger as well. And then we'll mobilize the joints when we turn that hand round. So generally you might only spend about 3 to 5 minutes within a wider treatment on this area, but if you did have a specific hand injury, then you can spend longer. So now what I'm doing is coming up in between these metacarpal bones. So I'm just doing small circular motions in between the bones there, about 4 to 5 times before I move on to the next one. Still being mindful of your own body position. Okay. And then coming up in between the thumb. Quite often got a nice trigger point in this area here, so it's nice just to apply a little bit more pressure in that area, especially if your client suffers from any joint conditions. Okay, and then from there we're going to come into that full arm effleurage again. And then we're just going to bring the focus around the wrist, around these styloid processes. So quite often we can have restricted movement around this area, so it's nice just to pay a little bit of attention to this joint. Okay, and then from here we're then going to mobilize the finger joints. So now what I'm doing is I'm coming down and gripping here, okay, just below the knuckle. I'm literally moving that knuckle joint up and down. So we've got a nice grip around the wrist, but without compressing that wrist too much. And then on to the next one. So we want to stretch it and then up and down. Okay, stretch and up and down, and stretch and up and down. Okay, and then the last one here on the thumb, again stretching here and up and down at that joint. Okay, if we had more time, we could then repeat that to extend the treatment. Okay, so that was our demonstration of foundation massage techniques to the hand.